Good afternoon. My name is Motooka-Halseth. I am presenting improving medication adherence in Hispanic population with type 2 diabetes using text messaging. According to CDC and Office of Disease Prevention and Health Promotion, uncontrolled type 2 diabetes is more prevalent in Mexican Americans compared to white population in the United States. During the years from 2011 to 2014, only 54% of white people with diabetes had hemoglobin A1C less than 7%. The rates were worse for Mexican Americans, it was at 42%. One of the components of the treatment of type 2 diabetes is pharmacological intervention. Medication adherence is associated with better clinical outcomes and glycemic control. However, in the United States, only 80% of prescribed medications are filled at the pharmacies, and of those, only 50% is taken correctly. There needs to be a secondary intervention that is focused for Hispanic population in the United States so that they can adhere to the medication regimen to control type 2 diabetes to avoid health complications. The population that I'm targeting is Hispanic adults who are older than 18 with type 2 diabetes who attends the community medical center at Waterloo. It is a primary care clinic at City of Stockton. It's located at south side of Stockton where resources are a little bit limited and the neighborhoods are a little bit rough. For participant selection, patients with hemoglobin A1C higher than 9% will be identified with the software that we use. It's called I2I. Participants will be contacted by phone or via patient portal messaging by medical receptionists. The data will be run to identify the patient who has been to the clinic for in the past 2 months to see which one has the type 2 diabetes and with hemoglobin A1C higher than 9%. And in the past month, it has been that at least 15 to 20 patients are coming up monthly with hemoglobin A1C of 9%. And patient's family member who resides with patient must have a smartphone in order to participate to the study. Using social cognitive theory, this project is goal to create the patient-centered environment that makes it easier for them to take prescribed medication as directed, leading the participant to achieve higher self-efficacy. So we want to create the patient centered environment where it makes it easier for them to take the medication. How do we do that? By reminding them with a text message in real time when they have to take the medication. And also, we offer family-centered education. That way, not only the patient remembers, the family are able to remember and remind the patient to take medication. And we are also going to offer a service that is convenient for the patient to communicate to the care team, which consists of primary care provider and medical assistant and registered nurse by portal app. And also, we are going to provide access to reasonably priced medication for patients who don't have insurance. So hopefully by changing the environmental factor, it will lead to the better compliance or adherence to the medication regimen. So the first study that I looked at was the study that was done in university in Pakistan in Karachi. The title was Medication Adherence in Adult Stroke Patients with Text Messaging Service. Even though this was directed to a patient who had a stroke, I would think that chronic disease management, such as hypertension management and diabetes management, are very similar. So I thought that this is a good case study to study from. Um, this case study was done in Pakistan with 200 patients who has had a stroke 4 weeks ago, and this was controlled randomized study. This study was based on health belief model and social cognitive theory. The participants received text reminder for 2 months to take medication and also twice weekly for health information. The results showed Marsky medication adherence scale. It's a very simple questions to see if patients are able to take the medication regularly as directed. And the score was higher in the intervention group at 7.4, while control group had a 6.7. Another important finding that mean diastolic blood pressure in the intervention was 2.6 points lower than control group. This showed short intervention of customized text messaging service can improve medication adherence in resource poor areas, which overlap with my study. Second study is a mobile health intervention for diabetes for inner city patients with type 2 diabetes. This was ER-led studies designed for low-income bilingual population. Sample size was a little bit small at 23 patients, and median hemoglobin A1C was 8.9%, which was quite high, for 3 weeks. The text message was sent in English and or Spanish, and it was sent to patients 3 weeks straight for educational materials, motivational materials, diabetes trivia, medication reminders, and then also management tools. The results show that change in eating habits, increased vegetable intakes after the intervention, and also better medication adherence scale. The score raised to 4.75 5 points from 3.5, and also increased frequency of foot checks were reported, and also increased physical activity was reported. And also, this has a very high satisfaction rate from the participants. 90% would continue the program, and 10% would recommend the program to the family members. Third study was called Effective of Text Messaging System on Diabetes Management. And this was controlled study, and 34 participants were studied for 3 months. This was done by endocrinology group from Bahrain. An intervention group was given access to clinician's number and diabetic educator's mobile phone number, and text messaging was used to support patients' needs, solve problems, or send home glucose level for the monitoring. So this is not really a texting reminder to take medications. However, I wanted to see if the communication support from the clinicians and care team would increase the adherent behavior of patient. And both intervention and control group had a significant reduction in A1C. And intervention group had a greater reduction, 1.16% lower than control group. The service was highly satisfactory to the participants. And also, these messaging contents, majority of them were home glucose value for review for the clinicians. Other ones were dietary inquiries, hypo and hyperglycemia situation consultation, and then medication timing and side effects consultations. Reviewing all those studies gave me an idea for interventions, and all services are available in Spanish. First, for the study, initial medication education will be provided to the patients and families. Medication regimens will be reviewed by nurse, and also simple mechanism of action and directions to take the medication will be reviewed by the patient and also with the family members. Pocket-sized laminated medication list will be given to the patient, which states indication and a frequency of the medication that needs to be taken. Patient can keep it with their purse or they can put it up on the refrigerator. And also pill case will be supplied to the patient. And then also for the patient who are taking insulin, registered nurse will be able to review the injection with the patient and their family members. And also follow-up appointments are available. However, it is not required as these patients might have a hard time coming back to the clinic for appointment frequently. Also, at this time, participants are enrolled to customize automatic text reminders to take medication every day via Well app. It is already a used service for the appointment reminder. And also, frequency and reminder setting will be reviewed with the medical assistants and then it will be inputted to the system. And also, the medical assistant will upload the Well app, the patient port, but patient portal app to the smartphone. Through the patient portal, the patient will be able to message the care team, and then they will be available to answer the questions. Also, they are able to review the lab result on the patient portal app and request a refill of medication. Community Medical Center has a pharmacy that offers 340B federal drug discount program. So the patient who does not have insurance, they will be able to get discounted medication depending on how much they make, and then they can qualify for sliding fee discount. Intended outcome of the study is to improve their hemoglobin A1C and also to increase their self-efficacy. This will be measured by improved medication adherence scale and also increased accurate frequency in medication refill. So these items will be evaluated at 3 months. Hemoglobin A1C, the patient will be asked to get the labs done at 3 months and it will be compared to the pre-intervention level. And also self-efficacy, the medication adherence scale is given pre-intervention and post-intervention. It will be compared. And also pharmacy refill record, care team members will contact the pharmacy before and after the intervention to compare the refill frequency if that matches with the patient's medication record. Implication for this research, maybe this is a good area to explore. There might be a possibility of expanding the usage of text messaging to the complex case management, such as daily blood glucose monitoring, weight monitoring for CHF patients, and blood pressure monitoring for hypertension. Thank you for listening.